Hello, I'm Lawrence Bergstrom, registered osteopath and advanced trained non-surgical spinal disc decompression specialist. Have you been diagnosed with spinal stenosis? If you have and you don't know much about it, this video might help you. So what is stenosis? Quite simply, stenosis is a narrowing of a window or an aperture. Now, if we look at my model here, we have a window here at the side. We have a window in the center. So the center is where your spinal cord runs, and the side is where your peripheral nerves run. Now, you can have mild, moderate, or severe stenosis, and stenosis is a narrowing. Think of it as a central heating pipe that's furring up. The inside of it is getting so full with chalk deposits that window that was originally nice and open is now getting narrower and narrower and narrower. Now, why is that a problem? Nerves. Nerves do not like to be compressed in any way, shape or form. They are protected by bone that sits around them with an aperture for the nerve to pass through. Now, unfortunately, due to wear, tear, age, trauma, injury, lots of things like combat sports, these kinds of things, they all take their toll and they can leave a legacy. So as time goes on, what tends to happen is those little windows, those apertures, they get narrow. Now, if we don't have symptoms, we're happy. Whatever it is, we only start to worry when we get symptoms. We think, I don't feel right. What's not right at the moment? And then we start seeking help. So this can develop over a long period of time until the day that you think, I've got a cold patch on my leg, or I've got a burning sensation in my calf, or something along those lines. And then we start to think, what's going on? Now, somebody might say, oh, you've got sciatica. And it could be that you have sciatica, but the window that the nerve passed through is becoming so narrow, it's becoming what we call stenosed or stenosis. Now, with mild to moderate stenosis, we can do a lot to help you at the clinic. We use non-surgical, evidence-based technology to start decompressing nerve tissue. And we have a 92% success rate of greatly improving or resolving the problem. If the problem is severe, generally speaking, you're in the hands of an orthopedic consultant. There are times, even with some of the severe cases, we've had some success. However, normally at that point, you'll be in the hands of an orthopedic consultant for their opinion as well. If you have symptoms that you feel, they're not getting better, and it can be down an arm or a leg, sciatic type problems, nerve type problems, burning, numbness, tingling, a degree of weakness, these could all be signs of stenosis. Invariably, disc material, narrowing of the window, calcified ligaments, these kinds of things can play a part in it. But if it's progressing, medical imaging always plays its part here, and MRI, very important. We refer all our patients for MRI if they're having these symptoms that are dragging on and on and on, because it helps us to get a really clear picture of exactly what's going on. And in another video, we'll talk a little bit more about MRI and why we feel they're so important, how they help us diagnose your problem, safety net you, and get you to the place that you want to be, which is out of pain and back to your life. But we'll discuss that in another video. Okay, thank you for watching this video about stenosis. So in essence, narrowing of a window at the side of the spine or in the center can then start to lead to problems. Neurologically, sometimes vascular as well, can affect blood supply as well. But we'll talk about that in a further video too. Thanks for watching. Hope this has been helpful.